Hi, South Texas. It's good to be with you again. I'm here to give you another update, and similar to my previous one, they're going to be a series of videos, not just this one, because there's a lot of great activity at the South Texas Veterans Healthcare System. So in this particular video, I'm going to be talking to you in more detail about a few activities that have occurred over the last 6 weeks since my last update. I'm not going to go into a lot of detail about the 180-day plan. I'm going to let many of the leaders who are in charge of those initiatives give you more detailed updates. You won't be getting those as part of this video, but you will be getting them over the next 3 to 4 weeks as we release a series of updates from the specific leaders that are deploying some of the activities that I've charged them with. For example, you're going to be hearing first from Trish Lottie. Trish is our new Chief Experience Officer, a former Assistant Director for Operations. I'm really excited to have Trish in her new role as our Chief Experience Officer. So she'll have an opportunity to reintroduce herself to you and then talk about some of the activities that she's doing, specifically in her role now as the Chief Experience Officer and helping us build our new Experience Office, in addition to realignment of a number of other services that she's going to have under her domain. So look forward to that update from Trish. After that, you are going to hear from Dr. Evan Renz, our new ACOS for Quality Safety Value, and our Chief of Staff. They're going to be giving you updates again on some topics I talked about in the 180-day plan, specific to the establishment of QSV as a product line and what the change in that structure means for the organization, as well as talking about our high reliability journey and what we can expect to see over the next 30, 60, and 90 days, respectively. So again, look forward to that update. You'll also have an opportunity to meet Adam Bernal. Many of you know Adam. He's our Chief Engineer. With Trish's appointment as our Chief Experience Officer, Adam has been detailed as the Acting Assistant Director for what we're now calling the Assistant Director for Facilities. So Adam will have an opportunity in one of his videos to talk to you about the facility modernization activities and specifically what he's doing to fulfill some of that charge and building out our new engineering team and some of the projects that they're going to be focused on as part of that modernization. Last but not least, in this first series of updates, you'll hear from Lisa Simino, our Associate Director, and Dr. Baruch, our Chief of Medicine. They're going to be talking to you about some of the changes that we're making in new employee orientation and specifically some of the fine-tuning that we're doing for clinical staff to ensure that they're transitioned into the organization effectively. So look forward to those updates coming in the next several weeks. In this particular update for me, I'll be talking to you again about the Mission Act, and we brushed up on that topic in my last update to you. I'll give you an update on the market assessments, which again is, I know, something I shared with you in April. I told you we had an upcoming visit specific to the national market assessments, and that when we completed that visit, I'll tell you more about how it went. So I'll do that today. Then I'll also be talking to you about a myriad of community engagements, either things that we've done here on campus or activities that we've been involved in off campus, and then I'll give you a little bit of insight into some things to come. So let's get started, guys. The Mission Act. You know, the Secretary has officially dubbed May as Mission May, and that couldn't be further. I don't think we could say anything more accurate. There's a lot of activity right now behind the Mission Act nationwide. Congressional interest. Obviously, the President has seen this as a high priority piece of legislation for him, signed in June 2018. So there's a lot of expectations nationwide that facilities take this transition from choice to the Mission Act very seriously. And there's something that all of us can do to make that transition as smooth and as painless as we can for both our staff and for our veterans. And that starts with getting educated on what your specific role is with the Mission Act. And again, understanding some of the nuances of eligibility and claims processing and payment, etc. If you're watching this video now, I can assure you there's a Mission Act training that you're supposed to take. If you haven't logged into TMS in a while, I'd encourage you to log in. Most staff have at least 5 courses. They're all pretty quick, but very informational and informative. And the expectation is that our staff complete that training prior to June 6th. June 6th is when the Mission Act goes into place. We need to be a resource for our veterans prior to that date. So I implore you to log into TMS, take that training. I've had that discussion with your senior leadership at the service level and obviously here in the director's office to ensure that we're prioritizing that. Our education service is going to start providing me updates on that education three times a week so that we can get pretty detailed and granular at the service level as to where we still have opportunities for staff to complete that training. So I would encourage you to get involved in that process immediately. Again, some of those training topics will be eligibility for the Mission Act. There's a new tool that we're going to be using to manage consults. The acronym is DST, but it stands for the Decision Support Tool. It's going to be very important for our schedulers and our clinicians to understand DST, how to access it, and how it helps them determine veteran eligibility for care. You'll also have an opportunity in those training programs to learn about the new urgent care benefit. I think this is going to be a very popular one for our veterans. It does give them the opportunity to go to urgent care centers that will be in network. So if they do have those minor bumps and scrapes that may not necessitate them driving across town to come into a VA CBOC or to the hospital here at Audie Murphy, but it is intended to create more accessible care to them closer to their homes. But it's important for us to understand how that benefit works. So again, I would encourage you to take that training. The expectation at the national level, again, is that before June 6th, that our staff have completed that training, and we'll be continuing to give you updates via email on how we're doing meeting that expectation. So now let's talk about our market assessment. Now, so I told you all in April that VA, as part of the Mission Act, had deployed what were called market assessments. And this is where they took every VA healthcare system, identified us as being in a specific market, of which there were 96 identified for all of VA. There's a contractor that's been visiting VA facilities, walking through the data, telling us about our existing veteran population, where they're anticipating the veteran population was going to grow, which categories of care would likely be impacted by that population growth, and really putting us in a position to plan strategically for how we're going to meet either a growth curve or in some cases a shrinkage of workload in differing capacities. So let me give you the quick rundown of what the market assessment team identified for South Texas, and then we'll talk to you about what the next steps are. So in summary, the market assessment for the South Texas Veterans Healthcare System identified our market as the southern market as having the largest increase in veteran enrollment projected over the next 10 years and 20 years. So that's good news. Now, if we're going to have a challenge, we would like that challenge to be growth, but we are going to have to surmount that challenge. It also told us that we have actually on average a younger veteran population than what's the experience at the moment at the national level, but that as time passes and we hit that 10-year and 20-year curve, that we are going to see a shift to an older veteran population and need to be certain that we're prepared to provide the care that they need as convenient to that older population as we can. It also told us that we have an already large female veteran population that over the next 10 to 20 years is expected to grow by 41%. So that's significant growth in our female veteran population that's already sparked additional conversations with myself and the senior leadership team about wanting to ensure that we've got an infrastructure in place to meet the needs of that growing population, to include establishing our first women's clinic. And so we're having those conversations now. Obviously, with this growth, the team recommended and we're actively evaluating the potential for additional sites of care to ensure that when we reach that 10-year and 20-year horizon, we're well positioned as a healthcare system to meet that growing veteran population where they are. As we get more detailed information about where we think those additional sites of care may be, or existing sites of care that we look to expand, I'll be prepared to give you the details there, but can tell you that those conversations are active and ongoing. We have actually had some additional discussions with the Department of Defense about looking potentially at some joint care locations, as DoD is also in the midst of a market planning strategy. So we'll be having some of those conversations in the next week to identify any possibility of mission overlap to see if there's an opportunity for us to combine forces and have some joint sites of care. So I'm really excited about that opportunity to partner with DoD, and again, we'll give you more updates as those conversations continue. I did want to specifically thank our PPD, our Planning and Performance Service, for facilitating the market assessment. The team was very complimentary of our preparations and of the information that we had available to answer some of their questions. So thanks to that group. So I'll give you a few updates on a couple community and local engagements. I did have an opportunity in April to actually attend my very first CVA, which is the Concerned Veterans for America, attend a town hall with that group here in San Antonio. And Congressman Chip Roy, who I believe I shared some pictures with you in my previous video. He and I had gone to Kerrville, found out that he was going to be the guest speaker at this particular CVA town hall, and got an invite to come to that particular town hall session. Really enjoyed the engagement there with that veteran population. They asked us some great questions about VA healthcare and eligibility, and they had some concerns on the VBA side that we were able to share with our Veterans Benefits Administration counterparts. But a very engaging activity for me, and the veterans are very thankful that we were there and appreciated us for attending. We also had our Patient Experience Week. That was the week of April 22nd. A number of activities that occurred here at the healthcare system. I appreciate those who participated and told us what the patient experience meant to you all. I know that feedback was useful for Ms. Lottie in her transition again as the Chief Experience Officer. We also had our very first telephone town hall. I believe I shared that with you in April as well, and told you we were going to have our first telephone town hall. We did that on April 30th. We specifically called veterans who are eligible for the choice program under the 40-mile parameter. Those particular veterans did have their the coordination of their care transition back to VA effective May 1st. So we called that population of veterans, which for us was around 2,800. Had this upwards of 700 of them on the phone with us at one point in time, and I think at the lowest end we got to 300. They asked some really good questions. We had a chance to talk to them about the Mission Act and what the changes were going to mean for them, and gave us an opportunity to gauge their initial satisfaction with the choice program to ensure that we were able to at minimum sustain that level of satisfaction as we transition to facilitating their care at the facility level. So I appreciate our patient administration service leadership and the senior leadership team and public affairs for helping us put on that very first telephone town hall, and it was very well received. The majority of veterans at the end of that telephone town hall actually told me they prefer to have town halls with us that way instead of the face-to-face discussion, so we will continue to do that. So there were some other activities that happened in May. I want to thank Voluntary Service. They did host the National Advisory Committee meeting here. That really brings together a number of distinguished leaders from veteran service organizations, voluntary service leadership, and volunteers from across the country, as well as several staff from senior leadership posts throughout VA and or VHA. So two that I would mention that as part of their attendance at the National Advisory Council, stopped in to spend some time with me and the rest of the senior leadership team. John Jensen, who is the acting Deputy Chief of Staff for VA, did come in. We had a great opportunity to spend some time with Mr. Jensen, talk to him about the South Texas Veterans Healthcare System and a lot of the great activities happening here. He got a tour of several places in the facility, including polytrauma and the CLC. And I was really happy after his visit to have received an email from him that said he enjoyed his time here, and that after interacting with our staff and leadership, that he had no doubt that this was a what he described as a clean and well-kept facility with leadership who gets it. So that was great to hear. I also had an opportunity to spend a little bit of time with Tracy Gaudet. Tracy is the National Director for Whole Health, and she's really excited about South Texas's continued flagship status as a whole health facility. And you wanted to be certain that I had all the information that I needed to continue on the trajectory that program is on. So really a good opportunity to interact with Dr. Gaudet. On May 17th, we had a welcome home event. This was at Morgan's Wonderland. It was the first event of this magnitude that I've attended in my career, and really wanted to thank social work and our CWT staff. I know we had HR personnel there, and MAS, and polytrauma, and a myriad of other VA staff programs marketing our services and telling veterans about not just their eligibility for VA healthcare, but talking to them specifically about some of the programs that we offer. And also talk to them about employment opportunities in the healthcare system, and HR was there to receive applications. But personally, I made a lot of really good connections with other leaders and other veteran-focused organizations in the San Antonio area, and was just amazed by the passion and the spirit of the group of folks who turned out. So definitely understand why we do those, and look forward to continuing them in the future. We also had a job fair that HR sponsored in May, specifically for engineering, and want to thank HR. They had a lot of energy behind that. I think as a result of some of that energy that was exuding from HR and some assistance from public affairs, We had both media coverage for that job fair and even some congressional assistance, as Congressman Will Hurd actually retweeted our job fair and I think drove some of the attendance. And I believe we had over 150 people show up for that job fair and did make several selections on site. During the month of May, I also had the opportunity to meet Vice Admiral Bono. Vice Admiral Bono leads the Defense Health Agency. So this is the newly forming consolidated branches of the military that are putting together a single healthcare system for all branches. Very engaging discussion. She met with myself, our chief of staff, and several of the leaders from local military treatment facilities. And she was specifically interested in spending time here in San Antonio because of the myriad of excellent sharing agreements that we have here at the South Texas Veterans Healthcare System with our DoD counterparts. I wanted to understand how those agreements were established and thought they really could be the model nationally. So it was great to hear that support. And we also had the opportunity to talk with her about those joint sites of care that I mentioned to you earlier. And she was very supportive of that and said she'd do whatever she could to move that mission forward. So that was exciting to hear and look forward to working with her. Additionally, during the month of May, we had Nurses Week. That was the week of May 6th. A lot of activities. I just really can't give enough kudos to Valerie, our nurse executive here, and just the amazing things that I've seen her and her leadership accomplish with nursing service. Specific congratulations to several awardees during Nurses Week. I had a note that we had a Daisy Award winner. This was our Daisy Nurse Leader Award that went to Kim Oakman. Kim is the Chief Nurse for Home and Community-Based Care. So congratulations to you, Kim. I also saw that the MICU was awarded the annual Daisy Team Award. So congratulations to the MICU. And several other awardees. There was several awards for the Secretary's Excellence in Nursing Award. That went to Justin Messmer in ED. He's a health tech there. Terry Arbeiter on 2 West as an LVN. Ellen Kango in PCU, RN. And an RN Expanded Role Award went to Dr. Salida Martinez Vega in MICU. So congratulations to you all. I also want to give a quick congratulations and really appreciation to several staff, Marianne and Dr. Lee specifically, in the hospital and home program. I had my very first opportunity to go on a ride-along with that group on May 20th, and just can't say enough about the level of care and the quality of care and really the compassion at which I was able to see that team care for a veteran in his private and personal residence. It was just an amazing experience for me, and I appreciate them giving me the opportunity to go along with them. I also had the opportunity that same day to spend some time with Lakeisha. Lakeisha is a health coach and part of our expanded whole health journey. And I had the opportunity to sit with Lakeisha and a veteran as she introduced him to whole health and explained to him the transformation that VHA is making and how we care for veterans and putting them at the center of everything that we do. And as a result of her excellent engagement with that veteran, I was there when he signed up for battlefield acupuncture. So great job to Lakeisha and the whole health team. So some upcoming activities, folks. June 3rd, the all-employee survey is going to start. Now, I know we've got a lot of stuff happening in June. We've got the Mission Act that's going to deploy June 6th, but the all-employee survey is absolutely important to the organization. I need to hear from you. I know the leadership team would love to hear from you. So you're going to start seeing more activities about the all-employee survey and encouraging you to participate. So please do that. As I mentioned, June 6th, the Mission Act implementation begins. We are going to be having another telephone town hall. This one will be in mid-June, and it's going to be specific to our female veteran population. And we're going to be doing this telephone town hall in coordination with Congressman Will Hurd's office. So more on that after that telephone town hall. We'll let you know what that a group of veterans thought about our healthcare system and what they think we could do to improve. Around June 28th, that date may shift slightly. We'll be having the groundbreaking ceremony for the Northwest Healthcare Center. I know we've formally referred to this as the Frank Tejeda replacement. That name has since been changed to the Northwest Healthcare Center, and we'll share some photographs with you once we get closer to that groundbreaking event and tell you how that goes. Guys, I'm going to finish today with a specific closing remark. I had a really interesting question that was asked by an employee about 2 weeks ago. And the question was, what is a chief experience officer, and, why do I think we need one? And, I gave that employee a response. I won't go into much detail about what I said to the employee, but I had a unique experience after that discussion that I thought was worth sharing. I'll give you the basics and then ask that you read an article that I'm going to be sharing with you in close proximity to this video. The article is about the experience of care. And, what do I think defines the experience of care? Many of you know, as I shared in my transition briefings, that both of my parents are veterans. And my father, an Air Force veteran, was recently diagnosed with lung cancer. And I had the opportunity to go with him to have a lobectomy at another VA medical center. And my takeaway from that experience of coordinating his care, going through the preoperative and postoperative and hospitalization process, is that as an organization, the focus that we put on improving the veteran experience is absolutely worth every penny. Because my takeaway from that experience was just as important as the quality of care, meaning what happens in the operating room and what happens on the inpatient unit clinically. There's so many other interactions that our veterans and their families have when they're in our organizations that everyone has to remember why we're here. From housekeepers to clerical staff to receptionists, everyone is important to the experience and shaping that ultimate experience. Because as much as our veterans experience our healthcare system from a quality perspective, their caregivers and loved ones experience a different aspect of the healthcare system. So I'm going to share that personal story with you, and I really look forward to hearing your feedback. We're actually activating a new communication system called Speak to the Director. I would expect you to have access to that link on our intranet shortly after the release of this video. So after you go through and read my personal story about my experience with my father, I'd love to hear your feedback and tell me what you think your role is in impacting the veteran experience. So with that, I want to thank you for choosing VA, and I want to thank you for choosing the South Texas Veterans Healthcare System. Thank you.